back. I'm going ahead to wash my hands and I introduce myself to the client. Hi, my name is Rose. May I know what your name and your date of birth is? Oh, verify your date of birth. Oh, Mrs. Smith, date of birth January 1, 1975. Correct. Okay, so I'm going to go ahead, Mrs. Smith, and grab my supplies. I'm here to do a peripheral IV for you. I understand that you'll be getting an infusion today, so I'm going to gather my supplies and then we're going to go from there. So yeah, I'm going to get my gloves and my saline infusion set, the label, a gauge 20 needle, tourniquet, alcohol swabs, and the screws, and there is a tape. So I got ready my tape and I'm going to go ahead and put my gloves on. So Mrs. Smith, tell me, do you have any allergy for anything? Okay, no? Yeah. Have you ever gotten a peripheral IV before? And how was the experience? Oh, okay. I'll try to be as gentle as possible. So you let me know when it hurts. So I'm going to go ahead and put that one away. And I'm going to prime my IV set. This one goes through the trash. And I'm going to go ahead and open this, put that in the trash, and open that and put that in the trash. And I'm going to go ahead and first of all get the air out, and then I'm going to prime it, and then I can see some bubbles coming out, and I'm going to go ahead and clamp it and it will be ready. Okay, so Mrs. Smith, I'm going to put a tourniquet on you so that we can put the peripheral IV. So tell me if it's too tight. Yeah, try and be gentle. Okay, so there you go. I feel it's not very tight, and I check the distal purse, it's there, and I put my tourniquet 4 inches from the distal area, so, and I can feel the pulse. So I'm going to go ahead and clean the area. So I'll take my alcohol swab and I will clean the area starting from the middle, going around to about 2 centimeters, and I'll leave the area to dry, and then I'll go get my 20 gauge needle, and I can see the area is dry now, and I will remove the cup, and I'll check the needle. See the bevel, it's up, and I will hold the skin down and pull it a little bit away from me, and I'm going to go ahead 90 degrees first. I go in and then I go to 30 degrees, and I go and proceed to 1.5 inches, and there you go. How you feeling? And then I'm going to remove my needle. There you go. I'm going to secure. I see a little bit of blood, and I'm going to go ahead and put my IV set, and then I remove my tourniquet, and I will unclamp my IV set, and I see the blood coming out, so I know the needle is in. I'll go ahead and draw a little bit of blood. You can see it's coming back, and then I'll go ahead and flush it. It's all done good, and I'll clamp back my IV, and I'll take my label to secure the needle, and I will put my needle and secure it without covering the set. And I'll go ahead and remove that. And I'll put this initial back for the initial here. Really put my name, date, and time. Yeah, how are you feeling? Oh, that was not very painful like the last time. Okay, I'm grateful to hear that. So I'm going to secure my IV set with a normal saline. So it's gonna be this way. Secure it. It doesn't come out and it doesn't. Got my initial gauge, date and gauge 20. And that's my initial RM, date 2/15/25, and a gauge 20. As you can see, I've labeled that. And yeah, and my patient is doing okay. There's nothing. I'm gonna clean up. I'm going to go ahead and remove my gloves and wash my hands. And thank you so much, Mrs. Smith, for your cooperation. That was amazing, and I hope I'll see you back again to remove your peripheral IV when you're done. Okay, thank you so much. Bye.